Hi, my name is Sarah. I'm going to be your nurse today. I want to go over some information with you to kind of give you an idea of what to expect in your pregnancy and your appointments with your provider. So your initial appointment with your provider is going to be the longest one that you'll have. We're going to check your weight and your blood pressure and look for any edema that you may have. We're also going to have you talk with the provider, and they're going to go over your health history, if you have any chronic medical problems such as diabetes, your surgical history, what medications that you take, and your previous history with pregnancies or obstetrics care. We'll go over that as well. If you're allergic to any medications or any foods, we're going to discuss that. We'll also do some lab work. So we're going to draw some blood and do a complete blood count. That's going to tell us if you are anemic or if you have any infections. We're also going to check your kidneys with a kidney function test to make sure that they're working okay. We're going to do some other blood work like an HIV test, hepatitis B, and we're also going to check for syphilis. We're going to do blood tests to check for your rubella titer to make sure that you are immune to rubella. We also want to check your blood type and your Rh factor and the antibodies there, so we can make sure that there's no problems with keeping your baby safe during pregnancy with that. And then we'll be doing some swabs as well, some vaginal swabs to check for chlamydia. And we are going to also do, and then each visit after that with your provider would be about every month or so. At your follow-up visits, you'll be able to ask your questions, or if you have any concerns about anything that we can help you with. At the initial visit too, I forgot to mention, we're going to do a urine test. We're going to check your urine for protein and glucose, and we'll also send it for a culture and see if there's any kind of an infection. We'll be able to check your urine as well for white blood cells, and that will help us know if there's any kind of an infection as well. At follow-up visits every month or so, we're going to check your weight and your blood pressure. You'll be able to ask your questions or talk about any concerns that you have. We're going to check your feet and your legs for any kind of swelling or edema. We're also going to listen to the baby's heartbeat, so fetal heart tones, to see how that's sounding and make sure that the baby's doing okay. We're going to measure your abdomen, so we can measure your uterus and see kind of how big that's getting. At about 24 to 28 weeks, we're going to do a vaginal swab, rectal swab, to check for a group B strep bacteria. And if that bacteria is present, then we just need to treat with antibiotics in order to keep your baby from getting that infection as you are delivering. We also are going to repeat some of those lab tests that we do in the first initial visit in your third trimester if that's necessary. Okay, in about 24 to 28 weeks, I apologize, so 24 to 28 weeks we're going to do a glucose tolerance test. At about 35 weeks we'll do the other test that I was talking about, the group B strep. Let's see, and then so that's about your visits. Diet, we want you to have a healthy diet. So you'll need to increase your daily caloric intake about 340 to 450 calories per day, depending on where you are in your pregnancy. And we want you to have a diet that's rich in folate. So you can get folate in foods like liver. If you're not a fan of liver, then you can also get folate in legumes and lentils, leafy greens such as spinach, asparagus, and you can also, we also want you to have a diet that's got plenty of protein in it, because we need you to have that protein to be able to help build all of this new stuff that your body's gonna be creating with you, making your so that you're able to have the protein and the necessary nutrients that you need for tissue building and things. We want you to have multivitamins, so you'll take a prenatal multivitamin that has extra folate in it, has extra iron in it. Iron's really important. Having an increase in iron is really important in pregnancy, because you're going to be having a lot more blood supply pumping around your body and in baby's body. Then you're also going to need to have some extra vitamins as well. Iodine is important in pregnancy. So those are some of the things that you'll need as far as diet goes. Exercise, it's very good to keep active during your pregnancy. So we want you to exercise for about 30 minutes a day. You can break that up into 2 or 3 blocks of 10 to 15 minutes if that's easier for you. But we do want you to get some exercise every day. It's best not to have high impact exercise though, so prefer not to run or things like that. Nothing dangerous like skydiving or playing contact sports. Playing basketball or hockey or something is not recommended during pregnancy. We would like for you to do something that's low impact. So swimming is great. Just walking is good. So just being able to get some exercise like that. So let's see, weight gain. So for about the first trimester, you're going to gain about 2 to 4 pounds total, and then after the first trimester, you'll gain about 1/2 pound to 1 pound every week, depending on your pre-pregnancy weight and BMI. So if you're underweight, your BMI is going to be less than 18.5. If that's the case, then you probably gain about 28 to 40 pounds. If you're normal weight, so your BMI would be between 18.5 and 24.9. There you would gain about 25 to 35 pounds. If you are overweight, that BMI is going to be 25 to 29.9, and you would gain about 15 to 25 pounds. And then if you are obese, the BMI would be 30 to 34.5, and there you're only going to gain about 11 to 15 pounds. So depending on what your pre-pregnancy weight and BMI is, then your provider is going to help you be able to get that most beneficial weight gain for you and for your baby. So some common complaints during pregnancy are nausea and vomiting. So the nausea can be caused by an increase in progesterone levels. And so one of the ways to be able to combat that nausea is to have just small, frequent meals throughout the day. So maybe even just snack size. Something to have a little bit of something in your stomach all day long, but where you're not having a whole lot more calories. Another thing that you can do, a lot of women try, is eating a couple crackers or something like that before they even get up out of bed. So before you even sit up, try a couple of crackers and then just wait a few minutes and see how you feel, and then go ahead and get up. See how that works for you. Another thing that a common complaint is leg cramps. So with leg cramps, that can be because of the increased like blood volume and things like that in your body. Sometimes it can cause some issues with nerves. It can also be a dietary thing, maybe because of calcium or magnesium. And so with that, you would want to just have some comfortable shoes. Doing some leg stretches and exercises is really helpful, as well as massage. That can help too. Another common complaint is constipation. So with the constipation, the extra iron in our prenatal vitamins that we want you to take, that can cause constipation. And so it's best to be able to just increase water, increase fiber, and exercise will also help with constipation. It's best not to take any stool softeners or laxatives, though, without talking to your provider first, because we don't want to cause any problems either for the baby or stool softeners pulling out too much water from your system. Some of the warning signs to watch out for would be nausea and vomiting, severe nausea and vomiting, constant nausea and vomiting. That can be something that needs to be treated and that you would contact your provider for right away. It can be a sign of hyperemesis, and that would be something that needs to be treated with some IV fluids and things like that, and monitor you so that you stay hydrated. Another thing that it can be an indication of is preeclampsia or high blood pressure. And so want to make sure that that's not an issue. Some other signs that are kind of signs and symptoms that are indicative of high blood pressure or preeclampsia would be increased weight gain and increased edema, headaches or blurry vision, or any kind of nervous system changes like that. Another major thing to watch for would be if you notice any changes in the way the baby is moving, kind of the patterns of movement, or if you're noticing less movement or no movement, that's something that you would need to call your provider for right away. That could mean that there's some fetal distress, or maybe even stillborn kind of situation. So we'd want to make sure that the baby's doing okay there. Another main problem that you would want to contact your doctor about would be bleeding, vaginal bleeding, or some severe abdominal pain. That could be an indication of problems with your placenta. So that would be placenta previa, where the placenta is covering over the cervix, and or else maybe the placenta has pulled away from the uterine wall, and that is an emergency and would be causing some bleeding. So those are some things to watch out for and that you would need to contact your provider for right away. I hope that this has helped you with some information and ways to alleviate maybe some of your questions or concerns. We're going to be doing lots of education all throughout your pregnancy, especially in the beginning. And so please be sure to ask us if you have any questions or concerns. Thank you so much.